morning, it's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're moments away from bringing you a live briefing from the South Korean health authorities on the coronavirus situation here in South Korea. Very soon, we'll cut into the briefing room at the Daejeon government complex with simultaneous interpretation available for you in English. Health Ministry official Taeho is expected to be giving us the details on the coronavirus situation here in the nation, filling us in on the number of new coronavirus infection cases seen as of midnight. Also, official YOON will be telling us what kind of efforts the government is making to contain this virus, especially as of late, where we saw many cases spiking in the Seoul metropolitan area. We've seen the number of cases continuing to pop up in daily life, in community centres, cafes, and that's why the government has raised the social distancing level to level 2. And now the Director General, he's taken to the podium, and we will now take a listen to what he has to say.
Let us begin our regular briefing for December 16th, Wednesday. As of today midnight, we have a total of 1,054 new local infections, and among them in the metropolitan area, we have 757 cases, while 297 were reported in the non-metropolitan area. We have 12 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And today we see 1,054 new local infections, and this is actually the highest daily tally since the first outbreak here in South Korea. We continue to see cluster infections, especially centering around the metropolitan area, and we also have many cases breaking out at the non-metropolitan area as well. And during the past week, on average, we have daily domestic cases standing at 832.6 cases, which falls under the threshold of level 3 social distancing. And this level 3 social distancing is the last resort that we can take, and in order to prevent any further damages of social and economic losses on our daily lives, we are also considering and mulling over the possibility of raising this level even one notch to level 3. And we need to also consider not only the daily cases, but also the reproductive index, as well as the ability, the medical ability as well, and the ratio of the senior patients, and also the effects, especially the social consensus and the social effects of social distancing measures. So this decision would entail a comprehensive consideration. And we need to also prevent us going to level 3, which will incur great losses in the self-employed as well as small business workers, owners that is. And therefore, we need to also ask you to continue to abide by social distancing measures, especially at level 2.5 right now. We will also exert our full efforts to contain the virus going forward. And to this end, the government will also have to deal with the lack of the medical capacity, especially with the rise in the daily cases. For the next 20 days, even if we have over 1,000 cases, we need to secure more than 10,000 hospital beds. And this has been announced last weekend. And also, we have our aim to secure 22 more. We actually secured 22 ICU beds, as well as 200 the designated hospital beds, as well as a total of 800 beds for the generally ill patients. And we also will successfully secure about 600 beds for the life treatment centers, especially at these metropolitan areas. And taking this into consideration, the hospitals of the the utility rate of these hospitals now stand at 51% at the metropolitan and non-metropolitan regions. And this means that those with mild or light symptoms, we have not seen a major burden as of yet. And as for the critically ill patients and the ICU beds, we will be securing more hospital beds going forward, and we are exerting our full efforts to this end. Especially, we will be transforming hospitals, especially 13 hospitals, to switch to treat these critically ill patients and secure 34 hospital beds until year end, and additional 21 additional beds for the year end as well. And we will also designate more hospitals to treat these critically ill patients. And going forward, we have designated 15 hospitals to treat the critically ill patients and secured 59 hospital beds for the ICU beds. And we would like to exert our deepest gratitude to all of the hospital staff members as well as medical staff members who have been exerting their full efforts to treat these patients. And to this end, the government will also make sure that we provide necessary support and incentives for the hospital so that they can focus on treating the patients. And during this week, we will also have the pre-advanced payment of the coverage of the health insurance, and they will be given based on the applications for all of the hospitals nationwide. And they also will be subsidized with 1 month of salary, and they will also medical income, and we will also provide these incentives going forward. And here are some of our capacity to increase the testings at the metropolitan area, and we aim to also cut the chains of transmissions. And during the next 3 weeks, we have established the treating the testing sites at these metropolitan areas. And as of yesterday, we have 73 new makeshift screening centers, and we have identified 19 confirmed patients from about 10,000 cases that have been conducted so far. And currently, we also have about 40,000 capacity to test on a daily basis, and we will also increase this number going forward. And in the metropolitan area, people can provide only their contact number, and this anonymous testings will be provided as well. And this will also ensure convenience for the residents here in the metropolitan area. So we ask you to get tested as soon as possible if you see the need to do so. And lately, we have seen many cluster infections stemming from high-risk facilities, including nursing hospitals, nursing homes, and religious facilities. And to this end, we have been also conducting PCR testings for those who are working at nursing hospitals. And in the metropolitan area, we have reduced the time, the period, the interval of these testings from 2 weeks to 1 week in the metropolitan area. And if needed, we will also provide the swift antigen testings at the metropolitan areas nursing hospitals so that we can ensure a swift testing of those who are in need of these testings. And together with this, the local government as well as the public insurance center will also make sure that we take into the consideration the on-field and on-site inspections for quarantine measures, and making sure that we curb the virus spread and spread from these caregivers. We ask you to comply with quarantine measures going forward. And at religious facilities, after December, we have a total of 547 cases from 10 cluster infections. And many of these cases broke out at those small facilities that did not have a great and full control of quarantine measures. And many of them had physical contact at confined spaces, which had poor ventilation. They shared meals together, and they also did not wear face masks properly. And during the past time, we have also seen many religious facilities partaking in the quarantine measures, and we would like to extend our deepest gratitude to once again. However, at small to medium religious circles, we also have seen some breaches. So going forward, we ask for your continued participation. And with the COVID-19 spreading very fast, we also have psychological support for the public. Up until now, the government has provided pan-government support for these psychological consulting sessions, and we have provided more than 3 million cases of consulting sessions to the public. And as we see another sporadic outbreak and major wave of the COVID-19, we will also provide similar consultation sessions for those who are in need. And especially at public health centers, we will have a list of people who will be subject to these consultations, and we will look into this in depth. And we will also look into these patients who are isolated at life treatment centers, and so that we can provide necessary help and support. And by region, we will also set up more traumatic centers, and we will also mobilize more than 400 staff members to deal with these people who are in need. And with the large increase in the daily cases, we also have fake news spreading. And as we have seen in March, that has been proven as fake news. These similar rumors are once again spreading through text messages as well. And please note that spreading this fake news shall be prohibited going forward. And the government has, starting from the beginning of the response to COVID-19, we have been disclosing the related information in a transparent manner. So we ask you to comply with and trust the credible information that is shared to you by the government. And right now, it is crucial for the public to partake in the quarantine measures. Please put on hold on your social gatherings and meetings, and also stay home and cancel all of social outings and gatherings. Please note that the virus can spread at any place, at any time, and please also take into considerations. And if you have any symptoms, or if you are suspicious of having COVID-19, please get tested as soon as possible. This is the only way to protect your family and your loved ones. And please wear your face mask properly, and while you are indoors, please wear your face mask at all times. And please put on hold on all movement or physical and social activities, and wearing a face mask, and these small actions can save your daily routines. And the government will also exert our full efforts to contain the virus going forward. Thank you very much.
That was a government briefing. You just heard that, updating us on the latest COVID-19 situation in South Korea, which confirmed 1,078 new cases as of Wednesday midnight, bringing the accumulated total to over 45,442. Unfortunately, 12 people died. The death toll is now at 612. Well, that does it for our coverage of this morning's briefing by the Health Ministry. We will be back at 12 p.m. Korea time with our regular midday news with Mark Broom. Bye for now.